So if a patient goes to you and they need a full mouth of extractions or they're currently wearing a denture, what are their dental implant options when they go to your office?
When we're talking options for people who are missing their teeth or are about to be missing all of their teeth, there's two main broad classifications of what they can do. So they can do something with dentures that are removable, and they can do something with a bridge that is not removable. And so those are the two main options. Now with dentures, there are people who've been wearing dentures for a long time. They don't mind the plastic that's covering the roof of their mouth. They don't mind the fact they've gotten used to it.
Okay.
But what they hate is that their dentures are falling down and they're loose and all the rest of that. And there's $1 billion industry in denture glues. And even those don't work that well. And so those people will sometimes come in and they're looking for a very cost-effective solution, which is going to be to maybe put a couple of posts in and do a snap-on denture. So the denture is just clipping onto those posts and it's just keeping it steady. They're still, when they eat, all the pressure's still on their gums. So they can't chew with the same kind of force that you can with the fixed teeth.
But it's better than a regular denture.
But it's better than just having your denture moving around and falling down on you when you go to eat with, in public. So we have the clip-on denture, that's one. There's a second kind of denture appliance called a bar over denture. So we put in more implants. There's a structure that goes on called a bar, and then the denture sits on top of that bar. And so this allows them to eat with much more force.
Still a snap in, snap out.
Still snap in, snap out, but now the force of their chewing is supported by that bar directly on the implants. They're not chewing on the gums. You can only push on your gums so hard before they hurt.
Okay.
Right? And so the amount of force that denture wearers can chew with is much diminished compared to teeth. Okay. So the bar over denture is the best removable denture system that we have. And for some people, it's a very good solution, because some people have lost so much bone that if they had fixed teeth in there, it'd be almost impossible to keep them clean. Okay. So some of these people need to be able to take them out and clean them and put them back.
All right.
So that's the one category of people who are missing their teeth. The next category would be fixed teeth. So it's like getting your teeth back. There's nothing removable, no dentures, you're not taking them out, they're put into place, permanently affixed. Generally, the dentist might be able to remove them if we need to, do some maintenance on them or whatever, but you cannot remove those teeth.
You can eat whatever you want.
You can eat whatever you want. Bite into an apple, eat carrots, nuts, salad, right? The things that are very difficult to eat when you're wearing a denture. And generally, these fixed teeth are made of porcelain, so they're very strong. Dentures still have problems. Even when you fix them to implants, the denture teeth are made of plastic. They're not that strong. They can break. And we have this, and in fact, when you have implants, the denture teeth break even more often because because you can bite with more force, and then the teeth are just not strong enough. We have people, they chip the teeth off of their dentures because they crush them. They're eating so much stronger than they were before, and so that's one of the pros and cons, so to speak, of having fixed, having dentures that are removable but attached to implants. Is they do chew harder, stronger, but now they can crush teeth. So,
But isn't the upper denture fine? I mean, with the suction?
Sometimes it is. The thing that seems to separate the people who can wear a removable denture from the people who cannot wear a removable denture is the tongue.
Okay.
It's, some people have a large tongue, and it's the tongue that's holding the denture in place and they can eat. Most people, however, do not have a large tongue. Their tongue is normal sized, and when they eat, as soon as they put a little pressure on the front of the denture, the back is popping down, they bite on this side, that side's falling. They're having a lot of problems trying to keep these dentures in place. So most people have to accommodate their lifestyle to the prosthetic that they're wearing. And this is something that when they finally have their teeth replaced with a fixed prosthetic, it's a life changer.
So the roof of the mouth is not covered when you make them a brand new set of teeth.
They can taste food better. I don't know if you've ever had any kind of appliance on the roof of your mouth. We have patients who cannot wear anything. They gag. You have a hot coffee and you don't even know it's hot until it burns the back of your throat. Like there's a lot of things that these people wearing dentures have to accommodate to.
What do they like more? Do they like, when you take somebody with no teeth and give them a brand new set of teeth, do they like the appearance, or do they like the fact that they can eat and chew whatever they want?
Both. We have patients who come to us who really want the function. They come in and they can't eat properly anymore, and all they want to do is eat. Like that lady, I showed you a case where this lady had no teeth and wanted to eat a salad, right? And so some people come for the function. Some people come for the looks. But what I find is inevitably, whatever it was that drove you in, yes, you wanted the function, but now you're like, oh my God, they look so great. Now I can smile and laugh, and sometimes we create cosmetic monsters, right? They weren't fussy before, but now they've realized what
I guess
it can do
after
for
a few
them.
compliments, now they're smiling all over town.
Yeah, and you see them, when they come back in later. Their hair is done, their makeup is on, the men look better, the women look better. Like there's just this confidence that they exude. It really is dramatic.
And you said the opposite's true. So some people they want a better looking smile. They like the fact that they could eat and chew.
Absolutely, yeah. So some people who are wearing dentures have great smiles with their dentures, but they can't function. So
they can't eat. They
yeah.
can't eat
So
very
the
well.
aesthetics for them has not really been a problem because some dentures look pretty decent, right? It's the function that's terrible. Other people come in and their teeth are a mess, right? It's just, unfortunately, life has happened to them. While they were busy raising their children and taking care of everybody else, this suffered.
So in your practice, they could get a snap-in, snap-out set of teeth or a set of teeth that don't come in and out.
Correct.
How soon on the consult? Now, by the way, if everything works out great, because you call it teeth in a day,
Right.
In very few appointments, I mean, you're doing, and I'm trying not to side with you, but it's in my notes, that what takes most guys 9 months or a year, you're doing in a few visits. Is that right?
That's correct. And this is becoming the way that things are being done. So the trend is pushing in this direction where more and more and more people are learning how to do it. They're just beginning this phase of their careers where they're starting to do these kind of procedures. And it's a steep learning curve.
And you've done thousands.
I've done
More
many.
More than 4,000 implants.
Yes. And so it's a steep learning curve. Let's just put it that way. And
So find somebody with experience to do
find
this.
somebody with experience.
Doesn't cost more to go to a guy with experience.
Well, I think it's like in everything in life. If you're going to build a house, you're going to do your teeth, whatever it is you're going to do, you don't want an inexperienced builder doing the work for you. And so
Probably less to go through an experienced guy than
Yes.
getting it done right the first time.
Yes.